who is the Policy and Advocacy Coordinator for the Greater Agency on Aging Resources. So I always kind of get that mixed up, so I have to pay attention. And Janet has worked in this area for a very, very long time. Her sort of expertise is more in the aging and disability piece with people as they travel through different chapters of their life. And she has worked on the floor, on the ground floor of providing care herself. She has worked as the director of an ADRC, and she is now working at the state level with BLAR. And so she has a wealth of experience. I think she will also tell you that she continues to be a care provider as well. So she's got the full picture in her life. Lynn Breedlove was the executive director of Disability Rights Wisconsin, and Lynn was with that organization for a very long time. He has dedicated himself, not just professionally, but personally, to this field. So even though he's retired, Lynn is here. He works with policy issues all the time and helps train people to be active in the policy arena as well. And if you have any questions about that, please let us know. But our time is precious tonight, so I'm going to turn this over to them. I want to introduce one other person, which is Robert Craig, Dr. Robert Craig, who is the Executive Director of Citizen Action Wisconsin. Citizen Action Wisconsin has played a major role in providing sort of support at a very sort of an umbrella level for our little healthcare team. So anyway, I'm going to turn it over to Lynn.
Thanks, Ruth. I've been to the Eagles Club before. I like coming here because it seems like I'm always hanging out with activists up here. There's a lot of diehard Northwest Wisconsin advocates, and that's a good group to be with. So obviously, the sponsor organizations created this event because you're very concerned about what's happening in the workforce situation. And obviously you and the audience are coming here because you're concerned about it. A lot of us are concerned about it. It's becoming a really big issue all over Wisconsin and actually all over the United States. So there's two sides to that. And people are concerned because the crisis is getting worse. That's unfortunate. But there's a lot of momentum now around this issue too. It's affecting more and more people with disabilities and their families, more and more older adults and their families, more and more provider agencies who are having trouble finding workers, more and more people who would like to work in this field but can't afford to because the wages are too low and they can't get health insurance and you can't really support your family. So there's a bigger and bigger percentage of people in the United States that are feeling this crisis right now. And we're hoping that's ultimately going to lead to a situation in which decision makers are going to have to do something about it. Right now, I don't think that enough state legislators and enough people in the governor's office and the executive branch in Wisconsin are feeling it the way you guys are, and the way we are. Our job is going to be to help those decision makers feel how urgent this is, and how serious this is, and how this is affecting people's lives in a lot of different ways. And I think if we get people coming together like you guys tonight, and hopefully other people around Wisconsin, we're going to have an opportunity to change this. Oh, I lost the remote. Oh, you got it. I didn't lose it. So there's really two main parts of what we're going to talk about tonight. I'm going to talk about the crisis. I want to share with you some of the statistics, some of the data about it. You guys know there's a crisis. We're not trying to convince you that, but we want to give you some of the information that you can use in combination with your own stories to convey to decision makers how serious this is. And Janet and I pulled together quite a bit of stuff, but you've got it in the copy of the PowerPoint. And if there are people that don't have a copy of the PowerPoint, I assume we probably have more. Ruth, does anybody? Okay, keep your hands up, and it looks like you've got copies coming your way. We didn't want you to have to try to make notes on all this stuff, because there's a lot here, but you'll have it in your copy, so you won't need notes. The other thing we're going to do is share with you, Janet's going to do this part, I'm going to share with you some of the current proposals that aging groups in Wisconsin and disability groups in Wisconsin are excited about and are planning to push in the upcoming state budget session, which starts in February. So we feel like this is a really good time to be talking about this. It's campaign season, and what legislators have told me in the past is legislators listen more during campaign season than any other time. So this is a good time to be talking to them. But of course, state budget's only once every 2 years, and that's starting up soon, and so we have our kick in the can this winter to try to do something good on the workforce issues. So, we have about 90,000 paid direct care workers in Wisconsin. I'm going to talk about unpaid family caregivers in a minute, but right now I'm going to talk about paid direct care workers. I'm sure you're not surprised to know that 90% of them are women. You can see some of the job categories that are there. That little symbol up in the right-hand corner is our symbol of a tired direct care worker. So you're going to be hearing mostly from me about why direct care workers are tired. Then Janet's going to show you the happy direct care worker, which is hopefully what we would see more of if some of these ideas for change actually came about. So 2 years ago, the Survival Coalition, the big disability coalition in Wisconsin, did a survey of people with disabilities and families, and here's some of the things that they found. 95% had trouble finding workers. 85% did not have enough workers to fill all their approved hours. So think about that. It took us about 25 years to end wait lists for community services in Wisconsin, to get enough money so there would be money to pay for the hours of service that people needed. Well, we got that done, and we're one of only a handful of states in the country that got that done. But now we have a new kind of wait list. We have people with disabilities and older people who have funds approved for their services, and they're waiting for the worker. So we're not waiting for the money anymore, now we're waiting for the worker. So these wait lists hurt people just as much as the other wait lists that we used to have hurt people. 38% of the people with disabilities who were surveyed who have jobs said that they missed work or lost their job because of a worker shortage. There was no one to come in the morning and help them get ready for work and get to work. Or there was nobody on the job who could support them in their job. So they lost their job, or they missed work. And we're hearing more and more stories about people who miss medications or medical treatments or miss medical appointments. Well, for some people, that's not just an inconvenience. For some people, that's life in danger. There's some people who can't afford to miss treatments for more than a day or two without possibly ending up in the hospital. So these are pretty serious consequences that people talked about in the survey. Survival Coalition also reached out to provider agencies, and this is what they learned from that. Annual direct care worker turnover rate of 50%. So think about that. That means if an agency has 100 staff on January 1st, by December 31st, 50 of them are gone and replaced with new people. And we know that in the disability field, some of these jobs require quite a bit of skill, quite a bit of training. A lot of new workers don't get very good at it for a while. It takes them a while to learn through the training, learn from other more experienced workers. And when the turnover rate is that high, it's really hard to sustain the skill level that you need. 93% of the provider agencies said they have difficulty filling job openings. We met with some provider folks this afternoon, and one of them said, recruitment never ends. We're doing recruitment 365 days a year. We can never stop because we never have all the positions filled. That's our new normal now. And some providers have told us, we can't really afford to let poor performing workers go. Because if we let them go, we're going to have another unfilled vacancy that we can't fill. So we kind of got to hang on to people even if they're really not doing their job very well. So if you're looking for a connection between the workforce crisis and service quality, there it is. And 51% of healthcare workers and 38% of nursing home workers are qualified for poverty programs. They are considered officially poor. Their wages are so low. They are qualifying for the programs that people who have no work at all are calling for. The Wisconsin Personal Services Association includes most of the agencies that provide Medicaid personal care. So this is a subgroup of the broader group of providers that the Survival Coalition was polling. And you can see, I'm not going to talk about all the things in here, but you can see that their survey of their members came out pretty similar. And if you think about Medicaid personal care, remember, it's Medicaid, it's federal and state money, but it's not somebody in Washington that decides what that Medicaid personal care rate is going to be, the rate of payment that's going to be paid to the personal care agencies. That's decided in Wisconsin. And the legislature can actually vote on that. They can actually say, that rate's too low, we're going to raise it. They raised it in the last budget by 2%. Which was nowhere near enough because there had been several budgets with no increases at all, so that didn't even start to catch up with inflation. But it's really important to know that your legislators in Northwest Wisconsin have something to say about this rate. And right now it's $16.40 an hour. And that rate has to cover the wages of the worker, payroll taxes, unemployment insurance, workers' compensation, the agency's administrative costs. They don't get extra money on top of that rate to pay for their headquarters and their schedulers and their secretaries. It has to pay for training, and for those people that are eligible for health insurance, it has to pay for that. So you take all those pieces out of $16.40, you end up lots of times down around $11 or $10 per hour for somebody to do a job that actually requires quite a bit of skill. That's a pretty important job for people. So if you look at the bottom of this slide, these organizations represent profit-making nursing homes, non-profit nursing homes, assisted living agencies. They did their own study, and that was actually earlier this year. They report a caregiver vacancy rate of 19%. But they say that 30% of their nursing homes and assisted living facilities have a caregiver vacancy rate above 25%. Okay, so think about 25%. Let's say your mom lives in an assisted living building, and on her floor there's 20 units. And there's supposed to be 4 staff there during the day. Well, there's only 3, because there's a 25% vacancy rate. That 4th job is empty. So those people are going to have to just get by with 3/4 of the support that they should be getting in that assisted living facility. All right, so I'm switching over to unpaid workers here for a minute. This is a national study that was done of family caregivers of people with intellectual or developmental disabilities. And so here, we're talking about the impact of caregiving on the employment situation of these family caregivers, most of whom had other jobs. You can see they had to cut back their hours, or take a leave of absence, or turn down a promotion, or retire early. They had performance or work attendance warnings because they were staying home to take care of their son or daughter with a disability. %48 of these people said they were very stressed or extremely stressed. On average, these family caregivers who were caring for people with developmental disabilities living in their home with them, they were averaging 57 hours of care a week, and most of them were not getting paid at all for any of that care. And most of these people had other jobs that they had to have because that's where they were earning money. They weren't earning money from this. I included this slide because I thought this was interesting. They asked these families, what are you worried about? So look at this list. I'm worried that the support for my son or daughter will decrease if I'm not there. 91%. I'm worried that no one else will provide the support that I'm providing. 80%. I'm worried that if I'm not supporting him or her, that maybe she'll have to move to another place and it won't be a place that he or she wants to live. 81%. I'm worried that she'll have to move to a congregate facility. 63%. Worried that his or her health will deteriorate. 78%. Or that she will experience abuse or neglect. 77%. So let me ask you, how many of you in this room are family caregivers? Show of hands. When you look at this list of what these people said they're worried about, how many of you are worried about one or more of these things? Okay, just about every hand that I saw is family caregivers. So you guys in Northwest Wisconsin, you reflect what these people in this national study are saying. So I'll just hit on a couple of these things. This is a 2015 study of family caregivers. Here again, mostly unpaid. Look at that second bullet. Estimated economic value of their unpaid contribution in Wisconsin was $7 billion. If these people were actually paid for the care that they're providing at the going rate, and that going rate's not very good, that would still be $7 billion. Well, you know what? That's just about the same as Wisconsin's annual Medicaid budget. That's $7.7 billion. So this is how much care is being provided without any pay for it. And then, look at that next one. A national survey of workers aged 25 and older, this isn't age 45 and older, this is age 25 and older, were asked, are you currently providing unpaid care to a relative or friend? 25% of them said yes. So look at the third one here. More than half of these family caregivers surveyed said that they felt overwhelmed by the amount of care their family member needs. And look at the last one. 38% reported moderate to a high degree of financial strain as a result of providing care. Because lots of times people have to quit their job or cut their hours way back. So then it's pretty hard to make ends meet. But you got to do it because it's the right thing to do. And I feel like these facts describe a crisis. It seems to me crisis is the word to use for this. So these maps show something that's very important. Now these are focused on older adults, but if you read in the middle there, this ratio is the population of ages 45 to 64 to those people who are aged 80 and older. So, for example, if your mom's 82 and you're 50, then you would be two of the people that would be counted and calculated in this ratio. And this ratio doesn't just count unemployed people who are caring for their mom. It counts everybody age 45 to 64, which includes some people that are working full-time. So when you look at this chart, what you really want to see is you want to see green counties. Because green counties are the counties where the ratio is highest, where there's several people available in the age group of 45 to 64 to take care of each person over 80. But as you will see, the colors change. In 2015, the Wisconsin average was 6.6 caregivers aged 45 to 64 for each person over age 80. But it's dropping every year. The dark blue counties are the scariest. The dark blue counties are the ones where it's getting down to 1 or 2 or 3 younger people for each older person. So then, look at let's see, I skipped over one. 2025 and 2030. You see, by 2030, all the green counties are gone. There are no places in Wisconsin where there's 9 younger people to take care of each older person. Those days are over. And you can see it's all blue and dark blue counties. And then you go to 2040, almost all dark blue. So pretty much statewide, there's 1, 2, or 3 younger people to take care of each older person. And that's ominous. And what we have to do is convince our legislators and our state officials and our governor that we don't want to wait until the crisis reaches those proportions when there's lots and lots of people living in situations where there's nobody at all to help them. I mean, that is a very scary kind of thing to imagine. So, if you sum all this up, and I apologize, I'm the one that has to report the dark side of the movement. You're going to hear something a little rosier from Janet. But basically, the emerging care gap, the crisis we're talking about, consists of a shortage of direct care workers, a shrinking pool of family caregivers, an aging population, and a low unemployment rate. Now, why isn't that low unemployment rate? Well, what that means is it's hard for provider agencies to find people who don't already have jobs, who would want to come take the job for direct care. And in an economy where the employment rate is low, everybody's raising their wages to compete for workers. You know, I'm seeing fast food restaurants in Madison now where they have signs out say, you know, hiring, starting wage $11. I mean, they realize now they've got to compete with all these other employers for this very scarce pool of workers, and the way to do that is raise their wages. Well, if all these non-long-term care jobs are raising wages, the gap between those wages and the jobs that we can offer in direct care, that gap's going to get bigger. And the wages of direct care workers are going to look less and less attractive when that gap gets bigger. So that's why that's important to us. So, Janet will give you something a little more hopeful.
So that's your happy worker up there. Thanks to Lynn for these lovely graphics. So I'm going to try to bring a little hope into our conversation this evening by talking a little bit about some of the good news. We're here, right? There is tremendous awareness around this issue. This is an issue we've been talking about for some time. It's clear it's not going away, but there's been a lot of public education about that, and this is a group and this is a community where that awareness has been taken to the next level, and everybody I'm talking to says it's time to take some action around this. It's time to quit talking and time to start doing, right? So that gives me reason for hope and reason to say this is some good news. Lynn mentioned that there are a variety of proposals being put forth by a number of advocacy groups and coalitions. Folks are starting at both the national and state level to say, okay, it's a big problem, it's a complex problem, but not so complex that we can't begin to sit down and say, how do we start moving us forward on this? What could we do that starts to make a difference? And people have been sitting down with stakeholders for some time now and saying, what could we start doing? And so these coalitions have been working together and saying, okay, you see this as something, we see this as something. Let's start coming together and forming even bigger groups with even more power. So that gives us some hope. Groups like the Wisconsin Long-Term Care Workforce Alliance. Workforce is a top priority for most of the major aging and disability advocacy organizations, and it's a top priority for voters, and it's a top priority for most of our legislators and candidates, right? So this is a big issue. Healthcare, long-term care, workforce issues, these are big, big issues. There are some exciting proposals, and we're going to go through some of the major ones. We'd be here all night if I were to talk about everyone, and we're not going to do that. So I want to take us through some of the big ones that are starting to get some traction. So I'm going to start on the paid worker side, on the paid direct care worker side, and I want to talk with one of the biggest things that we're hearing about, and that's around getting sufficient provider reimbursement from Medicaid to cover the actual cost of providing services so that we can pay our direct care workers a more competitive wage. You heard Lynn say that in our last state budget, our personal care workers got a 2% increase in their wages, right? Our request was for 15%. We were very excited that we got a 2% lift, but it was a far cry from what they needed. When we talked to the Wisconsin Personal Services Association, we heard that the current reimbursement rate is $16.73 an hour is what goes to the agency, but the actual cost of providing the service is $18.59. So there's no money left to give them a higher wage lift. So we have some proposals. The Wisconsin Personal Services Association would like to see a lift of an 11% increase in the personal services assistant rate. You heard Lynn say that this is a state issue. This is not a federal issue. Medicaid is a state-federal partnership, but states decide what services are covered and what rates can be paid. This is an issue we need to be lifting up if we're going to start making a difference in our communities. We're seeing the impact in turnover. We're seeing the impact in difficulty filling positions. I won't repeat everything Lynn said, or we'll be here all day. But this is something we have to start seeing move forward. We had some good news on this front recently. Many of you will remember in the last budget, we also saw some money that the legislature approved in the budget to give funds, $60 million in funds, to be exact, that went back to family care, managed care organizations to give to providers who are providing direct care services to individuals in our communities. This was to help lift up those direct care worker wages through bonuses, through sign-ons, through a variety of different ways. It was one-time money, so it was really hard to lift their wages permanently, but there's a variety of different creative ways that this money went back to workers as a lift to their income. We have just, as Lynn said, we're starting the budget process, right? Well, departments had to have their budgets into the governor's office this week, and we have learned that the Department of Health Services has included those funds again in their department budget. So there is some recognition within the department, even though they had tough, tight budgets as well, that it's really important that we continue those funds. Now, just because they put it in doesn't mean it stays in. So this is one of those areas where we really need to work hard to make sure those dollars stay in if we want to make sure we continue to support our direct care workers, not only in family care, but in the IRIS program, and to maybe expand who those dollars went to. There was a limited number of direct care worker positions that those dollars went to. So it's a start, right? It's the starting point of a recognition among public officials that this is a big, big issue. Number 2 up there is protecting the Medicaid benefits for the folks who are already eligible, who are doing direct care work. You heard Lynn say 51% of our healthcare workers and 38% of our nursing home workers are on public benefits. Well, guess what? There's a lot of Medicaid reform proposals out there, both in work requirements and drug testing and things, that we need to watch very carefully in terms of what are the impact that those proposals and other proposals might have on our direct care workforce. So for example, one of the things that we learned this week is that in Arizona, 4,000 folks were dropped from the Medicaid rolls as a result of implementing their new work requirements. Now, these aren't necessarily folks that weren't working. These are folks who 95% of which didn't complete the paperwork correctly. Okay? So we have to think about the implications of policy when we do these. We're talking about low-income workers who oftentimes don't have access to the internet at their homes, may have difficulty getting transportation to get access. So how are we, what are the implications of our policy, and how might that impact the ability of the workers we have to continue to do their work? And without health care and without food, with the food share program and other things, it's going to be really hard to keep working, and we can't afford to lose any more workers. So think about those things as we are fighting hard to maintain the workforce that we have. There's an interesting proposal that came out of the Disability Network. I know Survival Coalition has it on their list, as well as the Board for People with Developmental Disabilities. And it's a proposal to look at asking the Department of Health Services to write a waiver. And this waiver would be submitted to the Center for Medicare and Medicaid Services to ask for a buy-in program, an opportunity for workers who are currently working to work more hours, make more money, without risking losing their benefit, without risking losing that Badger Care benefit, because they aren't going to make enough to purchase health care, but without health care they can't work. So it's sort of a catch-22. So we have workers who are actually not taking more hours because they can't afford to lose the benefit. So we're looking at ways to incentivize working more, meeting more caregiver hour needs, right? It's a win-win without losing that benefit. So they buy into the program. They'd make a little more money, they'd have to pay a little premium, right? I mean, there'd be a sliding fee scale, but they would retain critical health insurance coverage, and we get more caregiver hours available to meet this crisis. So something we really would like to see discussed even further. Access to family and medical leave. So we have proposals at both the state and federal level to provide some access to our workers to paid family and medical leave. Right now, we have a lot of workers in this country and in this state that have to choose between work and family. So some really tough decisions, and I know many in this room, including myself, have to think about those things all the time. And yet, unpaid federal leave is actually inaccessible to over 60% of Wisconsin workers. Unpaid leave, not paid leave, unpaid leave. So they're really, really struggling with this decision. And the economic cost of taking off of work to provide care for your family, and we'll talk a little later about how many folks are doing that, has tremendous economic impact. Offering workers the support that they need to continue to be at work and to continue to not lose income so that they can provide for their families, and making that choice available is huge to support our workforce. So again, proposals at the state and federal level around this issue. And there's been tremendous support from legislators, different proposals, I might say, around how to do that, how to make that happen. I would keep in mind we need to do it in a way that doesn't impoverish them now or in the future. Funding to continue to attract and retain workers. The Wisconsin Caregiver Career Program, the Department of Health Services implemented a program whereby they were paying for the training and testing of workers in nursing facilities. They had some folks trained at the technical colleges, they had some folks trained in the nursing home programs, and they were paying for their training and testing. It's a great program, it was very popular, and folks who completed the schooling had their tests paid for, and then many of the nursing homes were providing a $500 bonus after they worked there for 6 months, and they had many nursing homes participating in that. We would love to see that continued, but the personal care workers would love to see that program expanded to include that kind of training and support for community-based workers. We need workers in every part of this system right now. So if it's working there, let's make it happen. Since it was a popular program, let's make it happen for community-based workers as well. A tremendously positive program. Last on this list is transportation subsidies. One of the things we hear a lot from workers who are out and about in the community is how very difficult it is to piece together enough different jobs to make it a full-time job, and the amount of time that they have to spend commuting between people that they're caring for, and that's unpaid time. It's unpaid time and it's unpaid mileage. So this is a very costly thing for workers. If we could be reimbursing their commuting time, it would really make it much more affordable for workers who are already, as we know, very low paid to do the work that they do, and yet we need them to, in these small allotments of time that they get at each of these houses, it really would make a tremendous difference if we could provide transportation subsidies to these folks. I want to move us to some proposals to support our family caregivers who are unpaid, and you're going to see a little bit of similarity here. The first one is a state tax credit. We had in the last budget a proposal to offer a state tax credit to family caregivers. This was a credit that would allow them on their taxes to claim up to $1,000 for expenses that they paid out of pocket. And what we know is that caregivers spend on average about $7,000 per year out of their own pocket. It's a very, it's not only the time and the emotional drainingness that it can be, it's also the financial time off of work and time spent on services and supports for your loved one. We were not successful in that. It was a pretty high price tag on that caregiver tax credit. We're reworking that proposal in hopes that we can bring that price tag down, but we have got to recognize that when caregivers are leaving work, reducing hours, and spending money out of their pocket, we're creating the next generation of folks who, when they get to their own long-term care needs and retirement, are not going to have the financial security they need to meet their own needs. So we're just creating more folks who are going to need public benefits to take care of their own long-term care needs. How we figure that out is by addressing right up front the fact that we support them so that they can continue working and recognize the money that they're spending out of pocket right now. The next one on that list is the family leave, and I have it on this list as well because what we know is 60% of family caregivers are employed. 60%, and the majority, and Lynn alluded to this earlier, are working full-time. So this is us. This isn't somebody else. This is us. And when we talk about these proposals, I want you to think about is in a minute how we pay for these, that we're not planning this for somebody else, we're planning this for us. The CARE Act, this one's near and dear to me. The CARE Act is a bill that's been passed in 36 states in the country as of May of this year. It has not yet been passed in Wisconsin. And what the CARE Act does is say to you family caregiver, that we recognize you're a valuable part of the healthcare team. And as such, we think you should be notified if your family member acknowledges you and wants you on the plan when this person's hospitalized. You should be notified when somebody's being discharged. Okay? You should be listed on the care plan, or you should be notified when somebody's being discharged, and prior to discharge, you should be properly trained and shown how to provide the care that you're going to be providing. Seems like a no-brainer, right? I mean, if you're going to be going home and providing care, you want to be confident that you know how to provide the care that you're doing. But the care has become increasingly complex, much more medical care than we've ever seen before. Tube feedings and injections and all sorts of things that people don't just naturally know. That proposal has not been, we've had real difficulty in the state of Wisconsin getting that proposal to pass. And it's, another regulation on an industry that, many of our hospitals do a fantastic job. Some of them do a really good job most of the time, and some of them struggle with this. And I get that nobody wants more regulation, but as the caregiver who's been on the receiving end of this, I can tell you how scary it is for me. I certainly also know how scary it is for the person I'm providing care to have somebody who does not feel properly trained. And it also costs our healthcare system a tremendous amount of money when things go wrong and the person needs to go back into the hospital, right? So we can be penny wise and dollar foolish if we don't think about how important these caregivers are to our overall healthcare team.
Hey, Jan.
Yes?
Ask the group if they think this CARE Act's a good idea. Show of hands.
All right. I'd like to know how popular you think this CARE Act is. How many think we should be supporting that? I like the numbers. I like it. I like it. Thanks, Lynn. Increasing access to supports for caregivers. Supports like respite care. 2 budgets ago, I believe, we passed, the legislature put in place a $1 million increase in the Alzheimer's Family and Caregiver Support dollars. It was the first increase that program had seen in ages. We know that of all caregiving for someone who's living with dementia is the most stressful of all. Those dollars were used for respite. Caregiver respite is golden. It's what allows caregivers to keep doing what they're doing. And it's the first time Alzheimer's Family and Caregiver Support dollars went to tribes. It's the first time they had access to those dollars. Huge, huge improvements. We need to make sure that we look at both at our national level in the National Family Caregiver Support Program, the Alzheimer's programs, and our lifespan respite programs, that we make sure that funding and opportunities for respite are available. Workers are a key part of that, right? I mean, we have to have funding, but we have to have the workers to provide it. But respite is what allows caregivers to keep doing what they're doing. We need to look at other caregiver support services like the evidence-based programs like Powerful Tools for Caregiving. How do we make sure that we are managing our own healthcare, taking care of ourselves, not forgetting all too often. I was a volunteer first responder in my community for 16 years, and people did a tremendous job of caring for their loved ones, and so very often forgot to take care of themselves. And you want to talk about a crisis situation, go to the house go to a home where in the family it's the caregiver that's the one having the health emergency. And now you've got 2 people who are in crisis because there's no one to provide care and you've got a person who doesn't even want to go to the hospital because they don't know what's going to happen to the person they're providing care for. We've got to do better, and there are ways that we can help caregivers recognize how critically important it is for them to be providing care for themselves. And we have a proposal in the legislature to support things like the Wisconsin Institute for Healthy Aging and bringing programs out to communities that are tried and true research-based programs that will help people take care of themselves and better manage their own health. Dementia care resources. We have in our state dementia care specialists that cover 2/3 of our older adult population in their state. We've got 1/3 left to go. The legislature last session gave us funding to continue the 19 existing and expand to 5 more dementia care specialists. So 2/3 of the state is done. We need the rest of the state to have access to dementia care specialists to make sure people know where the resources are, to make sure that we're creating dementia-capable communities and services so that people are responded to with respect and dignity and knowledgeably so that they get the care and treatment they deserve. We need to make sure that that happens in this budget. And last but certainly not least, and this relates to caregivers leaving the workforce, and that is creating some Social Security caregiver credits or pension credits for time left out of the workforce. We have 0 earnings years for those caregivers who leave the workforce. They have 0 earnings years that have long-term ramifications. Not only does it become very difficult sometimes to come back into the workforce, and most of those workers never make the wage that they made when they left the workforce, but those 0 earnings years will forever impact their retirement income in the future. And so we can fix that. There are multiple ways for us to address that. In the European Union, almost all of the public pension systems have some sort of a pension credit for their caregivers. Our poverty rates among older women are twice as high for older women than they are for men. And they're even higher for women who are providing unpaid care to children or sick or elderly relatives. We could do better than that. So we have some wonderful proposals. Some of these are state, some of these are federal. That last one goes directly to our congressional folks in the House and Senate. I would like to, before we have a little more action-oriented, turn the mic over to Dr. Robert Craig from Citizen Action. Okay. All right. Sorry. So before we move on to the other parts of our evening, questions for Lynn or I. Come on up, Lynn. Yes.
Do we know how many people die without the proper care that is getting either in the home or in nursing care?
The question was, do we know how many people die because they don't get the proper care in their homes or in nursing homes? I don't have an answer for that question. What I can tell you is that what we're hearing I get a lot of calls these days about people who are being forced from their homes into nursing facilities because they can't get the care they need in their homes right now. And we fought really hard in the state of Wisconsin for people to have choice, and now choice is being taken back away for a different reason.
I would just like to suggest that if there was a number to that, we would let our legislators know that's what I would consider age onset or disease onset abortion.
It's a hard question to answer because, of course, it's not as direct as that, but I understand the question. Yes?
That's what I think.
The 57.4 hours of care per week for family caregivers, does that include sleeping time, night time, or is this in a standalone?
That does not include sleeping time. That was a large survey done, and I think if you're referring to the number I think you are, it was an AARP survey. But I've seen that number vary greatly depending on who's done the survey, but it's a significant number of hours, and obviously it's an average, which means we have caregivers providing far more hours, but we also have lots of long-distance caregivers who are trying to do this in the evenings and on weekends as well, so the number varies greatly. Yes?
Do you know what the cost would be to the state to facilitate some of these proposals? Estimated cost?
So one thing Janet mentioned was in the last budget, it wasn't in the governor's proposal, but after the governor submitted his budget to the legislature, various groups advocated for adding some money to the budget to improve wages or bonuses or paid vacation for direct care workers. And that was $30 million of state money, and we got $30 million of federal dollars to match with that, so it was a total of $60 million. A lot of the provider agencies have said that that has been helpful to them. It's not like it solved the problem, but it's been helpful to them. We're encouraged that this time, with this budget that's coming up, the Department of Health Services is actually taking the initiative to say, we think that was a good thing to do, so we're going to actually recommend it to the governor this time. So if the governor accepts that recommendation and puts that in, then that'll be sort of the starting place for the budget, and we might be able to convince the legislature to go beyond that to make a bigger impact on the crisis. But, you know, that 11% increase for personal care rates, do you have any idea how much that costs? I mean, it's probably up in like the $30–40 million, because there's a lot of personal care workers in the state. Because there's so many people receiving long-term care, even small percentage increases in the reimbursement rates or in the wages add up to a lot of money.
But then we have to balance that out with, for those who are not getting the care that they want in the community, and if they're moving into the nursing home, what are the costs going to be there? I mean, everything you have to look at the whole picture, because the needs don't just go away. So if they're not getting them there because they can't find the workers and they're moving elsewhere, there's costs there. With some of the proposals, like the paid family and medical leave, some of the proposals are to create a family and medical leave insurance. So we're paying for that. We're going to pay for that the way we pay for Medicare, for example. So if each of us, and I guess I didn't cover that one very well, but if each of us pay for those, then which is why I said we're all going to be caregivers someday, like we might as well just count on it. You put that money in so when we need it, it's there. We need to start thinking ahead like that. Yes?
We talked a lot about home caregivers, and that's a terrible problem with it. And as you said, if there isn't people available, they get sent to a nursing home. But around our area, we have many nursing homes that are closed because of the lack of funding. They are not making it on it. And it's been a really sad thing that we have some very good nursing homes not able to make it. So is there any change in the proposals where you're making the deal system in the nursing home?
Yes. Yes. So her question was, we keep pointing to, you know, the proposals for home and community-based, and if we don't get funding there, they'll have to go to the nursing home. But by the way, the nursing home industry is saying, we're not making it either, and in fact, we've lost some really good nursing homes. And nursing homes are an important part of the continuum. So are there any proposals out there? Yes, there are. The nursing homes got some money in the last budget as well for people who had increased care needs. Their industry is putting forth a proposal to, again, get those increased funds to help their Medicaid reimbursement rates. Same issue, across the board, Medicaid reimbursement rates cover only a small portion of their overall costs, because they're an important part. And what happens when those care providers aren't there, which is who will care for us? We're all doing this. You know, well, family will go to here, and when family's not there, we look to the home care workers. And when home care workers aren't there, we look to the nursing home, and the nursing home saying we're not going to be there, and we're going further and further away from our communities to find care. And that has a tremendous impact on families, on individuals who receive care when their families aren't able to be a part of that very often because they're placed 50 and 100 miles away to find. We had a conversation earlier today where that was a situation for somebody in order to find the care her family member needed. For transportation issues, that's a whole nother ballgame, right? So we don't want our family members not in the communities where we are. So yes, they have a proposal as well.
Let's just take one more, okay?
George.
Yeah. When you show your map and the number of people that care for the number of elderly people, is there also a recognition because of the high-tech healthcare that we have, is we're going to need direct care workers longer in terms of how long we're going to need a direct care worker? Because I've seen earlier studies and earlier statistics that say, once you go to a nursing home, within 36 months, you would pass. I would argue that those numbers are those challenges are going to increase because our healthcare is so good that the interventions will keep people alive longer and they'll need complicated supports for longer.
That's a fair argument, George. I don't think they do. I think those numbers are based purely off of projected life expectancy and the numbers and the fact that our 85+ population is the fastest growing population. And so it's just to clearly show how quickly this is getting out of control. I mean, we're at about 6.8 to 1 right now, and we're going to be quickly moving all the way down to about a 3-to-1 ratio. And those caregivers may not be in our community, right? So it's a pretty scary place.
Janet, what was George's point?
Oh, I'm sorry. George's point was not only, when we look at these caregiver ratio maps, we're looking at sheer numbers of the population 80+ and the population 45 to 64, but are we really taking into consideration with advancements in healthcare how much longer people will be receiving long-term care supports than they have in the past? Because we really are, there used to be a statistic about once you move into the nursing home, nobody's there more than roughly 3 years, but that's really changing with advances in healthcare. And it's a really good point.
So Janet and I will hang around after if you guys have more questions, but we're getting a little behind on the agenda, so we don't want to do any more Q&A right now. So we're gonna hear from Robert Craig right now, and then I'll explain to you what we are proposing to do at your individual tables.
Thank you very much, Lynn and Janet. Great presentation. Again, know a number of you because you're members of the Western Wisconsin Organizing Co-op, but again, I'm Robert Craig. I'm the Executive Director of Citizen Action of Wisconsin. And in fact, Lynn used to be the Vice President of Citizen Action of Wisconsin for a number of years. So I know I'm doing that, and also when I was at SEIU, he and I worked a lot on home care. So I learned all how to handle the Capitol lobby from Lynn. Lynn's a great mentor, and you had 2 of the best speakers you could possibly have on this issue in the whole country. So thank you. And by the way, how many people here how many of you are members right now of the Citizen Action Co-op here? Great. And I'm the one, and I'm a member. We have them all over the state. And so if you're interested, please take a card, take information, and talk to one of the many members here. One of the things we're starting to do, I think people know that we're really the leading statewide voice, progressive voice on healthcare, and really guaranteeing that everyone has access to healthcare no matter what, eventually getting to Medicare for all. We made an assessment that healthcare needs to include long-term care, that the idea that they're separate things is just a kind of a historical legacy. It's not reality. Because if you don't have long-term care, how can you live a fulfilling and rich life, right? And we also saw the impact it has on family members and caregivers when you don't have access to long-term care. And so we raised some money to start working on this issue. And so our Milwaukee Organizing Cooperative has also had a forum on long-term care. And so we need to work on it, and we want to work with all of you in the co-op to make this a statewide campaign and support what Lynn and Janet were talking about, and add a lot more citizen voices to this critical issue. And so it's something that we definitely want. It's great that the Western Wisconsin Co-op is having this forum. It's a great start. We're also beginning to talk to candidates about it and inject a little bit in this election. So that Lynn pointed out, this is when elected officials are most, listen the most, is when they're on the ballot, right? Of those of all parties, just a characteristic of elected officials. And so, if you think about this also, obviously there's this healthcare connect, right? But there's also, I think, a really important economic justice connect to all of this. Look, I mean, these are jobs that we need a lot more caregivers, and we don't have enough of them now. And of course, in a market economy, you have to reflect that in pay and benefits to attract people and to respect the work, right? And obviously the very low pay, the inability to get enough hours, all of that, it's causing a crisis that'll get worse and worse, as Lynn pointed out. And so these are jobs that can't be outsourced. So in all these discussions about creating new jobs and attracting new industries, this is something that needs to happen in order to have a just society, a society where everyone can live a fulfilling life. So why not make these good and family-supporting jobs, right? And why not make it possible for people to take care of family members to do that well and have the support they need as well? And so this all ties in, and as we know, one of the reasons caregiving is so poorly paid, according to a lot of analysts, is because it's traditionally a job done by women. It was pointed out that 90% of caregivers are women, and we need to, when we're talking about gender equality and getting over kind of a history of inequality, we need to respect these jobs. These jobs are, in our society, what you pay a job does reflect how well it's respected. And this is some of those important and critical work, and it's very difficult work and complicated work that someone can do. So this is also getting towards getting equality. And I just want to say this, because we really look forward to working on this and getting deeply involved in this issue, is that I think Citizen Action Wisconsin, we have organizing co-ops around the state, and they're local and democratic, so they have their own views and make a lot of their own decisions. But I think what unites us is the idea that we're the ones who want to make democracy work for people, and the only place in our society where we would act in the common interest and take on the kind of big issues that Janet and Lynn were talking about is through our own democracy. There's no large interest out there, no corporation that has an interest in making sure that everyone has access to caregiving. And we had a lot we have to learn on this issue. It's complicated. I mean, I called Lynn up and said, we want to get universal long-term care. And Lynn said, no, 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 no. If you have a caregiver shortage, you'll make it worse if you suddenly make this universal long-term care benefit. But we'd like to get there. But to get there, you need even more workers than were talked about in the PowerPoint you just saw. So I think there's a lot we can do, and we really look forward to working with you all on this. And I hope if you're not a member of the organizing co-op that you'll consider joining, or at least get involved, go to some meetings, talk to some of the folks here who are actively involved. So thank you. I know you have so much in this PowerPoint to talk about. You want to get to that based on all of the material that has been shared by Janet and Lynn. So thank you very much, everyone.
Ruth was just reminding me that we really want to acknowledge the fact that there are some legislators here, some candidates for the legislature, and at least one congressional staffer here. This is a really busy season for them, and their time is pretty short, and we appreciate them taking the time to be here, be part of this conversation. We're not going to invite them to give a campaign speech, but we did want at least to have them stand up, tell you who they are, what office they're in, or what office they're running for, at least so that their face would be familiar to you. Because we're talking about decision makers here. We got some decision makers with us, so we got to take a minute for that. So I'll just start with you, and then maybe somebody else who can put their hand up and we can pass the mic around.
Yes, go ahead.
I'm Kathy Bernier. I have attended many of your meetings. I try to make it as often as I can. I'm a state representative now. I've served on the Aging and Long-Term Care Committee for the entire 8 years that I've served in the legislature. I'm looking to take my knowledge and expertise, your knowledge and expertise, to the state Senate, which November 6th can't come soon enough for me. And I'm over 60 and I should not wish time away. I was the author and gladly with the supported decision-making bill last session. I was intrigued by the CARE Act as it was discussed. So you did an unofficial survey. So may I do an unofficial survey? So if you had a loved one in the hospital and you were being released, was there a time in your life and your experience where they did not give you all the information you needed to provide that care? Well, I was assured by the Wisconsin Hospital Association, which went berserk, by the way, with your bill, that information is part of their current process, procedures, and laws. So clearly we need a informational hearing possibly on that. I'm having one coming up, by the way, on campaign elections. So thank you.
Hello, I'll try to be respectful of your time. So my name is Ren Katuri. I'm running for the 67th State Assembly District, and I live here just up the road in Chippewa Falls. And this is my first time running for elected office, and I'm a proud recipient of an endorsement from Citizen Action. So thank you so much for having me here tonight.
Good evening, Mark Allman from Congressman Ron Kine's office here in Eau Claire, and I appreciate the opportunity to listen and learn tonight and report back to Congressman Kine. Ron is on the Ways and Means Committee in the House, and that committee handles a lot of issues related to health care. So anything that we can share with Ron, definitely let us know. I'm here in Ron's Eau Claire office, but thanks for the opportunity.
I'll take that mic. First of all, I want to tell you how proud I am of Dawn and Barb and you know, the whole group that we started meeting to plan this thing. Ruth over there, as the organizer for Citizen Action in Western Wisconsin, and you all made me proud, because as I stepped away to run for office, it was all entirely up to you. And the last couple of days, I was thinking, oh geez, I've really let them down. I haven't built up a crowd for them. And look at what you did. You guys should be so proud. This is a really important issue. And one of the things that sticks out from that just jumps out at me is that really this legislature that we have, you're like children in a candy store when a private business wants tax credits. But when the people who care for our most vulnerable need a tax credit, it's too expensive. I'll bet it's less than $4 billion. Right? So we need to start thinking about our priorities in this state. And by the way, the other citizen action that I'm really proud of is action is, or possibility for a bill, is opening up Badger Care for everyone. So we all have opportunity, and that would certainly be another solution to our problems, right, Lynn? Thank you. What am I running for? Oh yeah, I am running for office. The 31st State Senate District, which is just a few miles south of here. And I hope that those of you who are here will keep that in mind. Thank you. All right, I'm Jeff Smith.
Thank you. My name is Charlie Warner. I am from Mondovi, Wisconsin, and I'm running for the assembly seat of the 93rd District. A large area that expands from Altoona, circles down to Brackett and Foster, and heads over to the big rivers, the Mississippi and everything. I don't include Trumpeter County or Jackson, but I have 5 counties and a lot of area that I hope to be elected because I'm campaigning, I'm sorry. There hasn't been a lot of change since 2010, and we do need to make some changes. I'm proudly been endorsed by Citizens Action, and just remember Charlie Warner, we want some change.
I'm Wendy Sue Johnson, and and I'm running for the 68th Assembly District, which is most of Eau Claire County. I have the northeast corner of Eau Claire, where we've lived for 4 generations, and Altoona, where I taught high school, and then all the way over to, well, southern end of Lake Wissota, along 29, not Cadott, Withee, Thorpe, Stanley, Boyd, Osseo, Fairchild, Fall Creek, Augusta, Humber, Greenwood, and most of Altoona, the piece that Charlie doesn't have. So pretty, again, big geographical area as well. And also endorsed, but more importantly, a member of Citizen Action. Jeff drew me in probably 2 years ago now to be a member, and it's really important work. And we need to continue to have conversations about economic inequality and paying people what they're worth, and I'm really glad to be here and learn more to bring down to Madison when I'm representing the 68th.
Okay, thanks very much for coming and for telling us who you are. So, we have a very straightforward idea. Oh, yeah, sure, go ahead.
I just want to make the point that if there's a legislator or a candidate not here tonight, it doesn't demonstrate a lack of interest. They have busy schedules, and people have come who can come, and we are grateful that they're taking their time to be here with us tonight. So just, I want to make a statement to be careful about making that judgment. We've certainly found partners on both sides of the aisle, and these issues are critical. So thank you.
So, some people volunteered to facilitate small group discussions, and we have a very straightforward idea for what that will be. One thing we would really like to hear from you on is what your concerns are. Like, are they more in the realm of the paid worker shortage, or are they more in the realm of the stresses on unpaid family caregivers? That would be useful to know. But even more important, in your small group, we're going to ask you to look back at those proposals that Janet talked about. We would really like to hear from you. Which of those proposals you're most excited about? Which of those do you think could make a difference and are worth fighting for? That would be useful feedback, not only for state-level aging organizations, the Long-Term Care Coalition, disability groups. It would be useful for Citizen Action to hear that. But also, it would be really useful for leaders in Northwest Wisconsin to know, okay, are there 1 or 2 or 3 of these proposals that we're going to really try to mobilize around and make sure that legislators in this part of the state hear that this is what we need. So it's going to be pretty simple, straightforward. The groups are small enough, everyone should have a chance to talk. And we're only going to do this for a few minutes, like I think about 20 minutes. Something like that. Oh, and then before we start though, I want to make sure before anyone leaves, Janet is going to tell you about a project that she's been working on, which I think is going to be a really important part of this mobilization.
So real quickly, we know that in order to move any of this forward, we need to make sure that stories get out. That when we all raise our hand, we all have a story to tell, and that those stories get heard by policymakers. So we have a story collection going on. You can copy down this very complicated link here and fill out the story online. I also was told that Ruth and or somebody might be able to send out this link to anybody who's left their email. But for those who like to just get it done, I have a hard copy of the survey that just has you tell us a little bit about you and what's your story. If you want to fill that out tonight and make sure that you are a part of making sure that your story is heard and you're lifting up your voice, you can do it tonight. And so we ran out and made hard copies so that those are here tonight. I will leave the stack up here if you didn't raise your hand right now to get one, and you can grab one there or get the link. Thank you.
What I'd like you to tell us is 3 things. One is, within your group, were more people concerned about a shortage of paid direct care workers, or were people more concerned about the stresses on unpaid family givers, caregivers? We'd like to hear that. Secondly, we'd like to hear which of the proposals that Janet talked about, is there one, is there two, whatever, but which ones were the ones that your group was most enthusiastic about? And then, we don't have a lot of time for the third thing, but if you have one or two examples of a story, which obviously you can't tell the story in length, but just a mini story from your group that seemed to relate to one of the proposals your group was excited about, that would be useful to hear. And I think we have enough time to do that if people don't make the stories too long. So I see you with notes there, so I'm assuming you're it.
I am it. But my table will tell me if I misrepresent it. So I'll have to stand up to Jesus. Okay.
Thank you.
I'm short and you can hardly tell when I stood up. All right, so for the first question, we basically had a tie between, yes.
Okay. What about number two?
Respite and tax breaks. That's what we had the tie between.
Okay, so, well, that's good to know. Those two are important.
Yes. And on the first one, what was the first question? It was both, okay. All right, thank you. Thank you. And then...
Were there any stories that really grabbed you from your group that relate to either of those proposals?
Well, there was a number. I think Kathy probably had the most because of some recent...
Give the mic to Kathy. We'll give her 1 minute to tell us a mini story.
Sorry.
I actually heard part of it, so it's good.
I think the fact that if people get like $1 or $2 more than what they're allowed to get other benefits that they can get, they're not going to be able to work extra hours or put the hours in. So then we're short of help, and you can't blame them because if they get $1 or $2 more than what they're allowed to get their other benefits, why would they put more time in?
So there's two things. You got it, Janet. There are two proposals, right?
Yep.
Okay, great. So who's talking here? All right. Very much.
We were talking mostly about the badge of care for all caregivers or some mechanism to keep them in healthcare. And my quick story is my program did a direct care pass-through with that extra funding that was passed by the legislature. One of my staff got a bonus of almost $900, which I wanted to make this a big celebration for all of my staff. And what ended up happening is she went into an absolute panic because she's likely to lose her health insurance, and immediately told me she wanted to reduce her hours. So that did not help us in the caregiver realm. And she's one of, I'm average, about 50% of my staff are on some kind of additional, benefits.
You got your hand up there. Oh, okay. I don't mind walking over there.
It was absolutely disgusting what we talked about, and
It is appalling. I came here to learn stuff, and boy, am I learning it. We support your proposal for people not losing their benefit if they work more hours, so that they wouldn't lose that. That's a great thing. But here, the thing is, are managed companies, managed care, healthcare companies, are they being looked at all? We have a situation here where a woman, an owner of a facility who has been in business for 30-some years, is being paid $45 a day for 24-hour care. That's $1,350 a month. That does not include transportation costs. that could be reimbursed by Medicaid for care that needs to transport out of their own pocket. They have to pay for transport to Minneapolis to get care for this individual. Any transportation to doctors' offices, those kinds of things, has to come out of the pocket of the person, of the owner of the house, of the facility that's caring for these people, because the money is going to managed care.
So, in terms of Janet's proposals, in addition to the opportunity for people to stay on Medicaid even if they earn more money, it sounds like the other issue is the provider reimbursement rates. Because what you're saying,
it doesn't trickle down, even
Right.
though Medicaid reimbursement levels or Medicare be increased, it is not trickling down to the people who are trying to provide excellent services to these people. Managed care companies have to be looked at.
yeah, I think Janet talked about that. It's like, if the legislature is going to allocate more money, they've got to make sure that it makes it to the providers and the workers. And that's one of the challenging things in terms of the budget, but we know there's ways to do it. Okay, now that I'm over on this end, who's talking here?
Yes. The table here was mostly concerned about paid direct care workers because the three individuals to my right use them every day. I know them from years ago and I've heard their stories. The thing we talked about is the proposals on the first slide with allocating sufficient reimbursement, protecting Medicaid benefits, and providing access to affordable health care. That to me and to the table is foundational. If people are making a livable wage and they have benefits, that also translates to how we value that in our society. In fact, that it is valued work, it is a profession that you can go into. It's people that they can sustain that will only get better as they do it. So once you have that as your foundation, you can build off of that in terms of incorporating family leave and some of the other proposals. So that was one of the foundation. Now in terms of the story, I'm just a family caregiver, but Jason can talk about his personal experience with direct care.
Okay, my wife Julie and I are on Iris, and we love Iris, but we're only allowed to pay a direct care worker $12 an hour. We've been we've been on personal care, approved personal care for the last 2 years, and we cannot find anybody to help us take a shower, help us in the bathroom, help us get dressed for that amount of money when they can go down the street to Woodlands and make $12 an hour begging groceries and not having to not have to do the work that is needed to allow Julie and I to be mobile in our wheelchairs and everyday life. I am one call away from being put into the hospital, and that St. Paul I could end up in a setting, rehabilitation center for God knows how long. It needs to change. It needs to change now.
Thanks, Jason. Who gets the mic?
Our group couldn't decide. We're just as worried about both sides of the aisle, the unpaid workers as well as the stress on the family care worker. And proposals that have already been echoing other people's comments is the dementia care respite and the transportation and being able to be reimbursed when you travel time and the tax breaks. And we actually had some really out of the box conversation over here that I thought was really good, and one I won't elaborate on it, but one is the need for intermediate programs like they do in the United Kingdom, where older people come together at cooperative housing, so they have the respite and the social needs are met and still getting care. The other thing that we think should be looked at is assisted dying. If somebody is done with quality of life and they want that choice, they should have that choice. Another thing we don't have in this country. And our story is one of our persons has a relative with severe dementia, bedridden in the city of Chicago, and that person's spouse pays a caregiver $18 an hour. But this is Chicago. This person is a Hispanic woman, so she has to pay her own health insurance, her own Social Security, et cetera, and you know that she's not, $18 an hour is not covering what she needs for her quality of life as well. Thank you.
Thank you. Somebody?
We also talked about the intermediate programs and alternative housing, and could they be within communities and have caregivers as helpers and utilizing neighbors and grandmas and grandpas. And that also worked out with, we want the the proposals basically were the caregiver support, identifying within our own community and within our own resources that we have here, who in the community that we could just call for that 15 minutes when you're just about to break. Especially some people with emotional difficulties and behaviors that gets very long and you can't even get away for 15 minutes. Who do you call within the community that would not say, what's the matter? You have you have spirit, don't you know how to take care of yourself? You just need somebody to help you for 15 minutes. Could you read story? So putting that in place would help. And the other thing was the paid family medical leave. We had a real interesting story from Nikki who had to go, who one time Ruth was very sick. She came in and assistance to Aaliyah. Hope you're okay if I'm using your name. And she was so sick, Nikki assessed the situation and said, hey, we're gonna pack a suitcase here and let's go to my house. And she took care of her for 3 days or 4 days until you recovered. There was absolutely no other amount of money that she had. And she took care of her 24 hours a day for 3 solid days and into 4. And if that would not have happened, what would have happened to Aaliyah? What would have happened to Ruth? And so maybe could Family Leave Act also include not just that particular caregiver, but also the family or the child if anyone gets sick, not just a one-way stream, but can the streams go both ways? And if they can, why not? I mean, you know, okay, we'll change legislation. Are any legislators here then?
Thank you. How about here?
So our group said both, that they really go hand in hand, so it's hard to choose one over the other. Yep. And then we talked about a lot of options, but not having fair losing benefits was one of the top issues that came up, and also making the positions more attractive for folks, but the funding has to be there with training, with compensation, with benefits, etc. And then I don't really have a story, but a little thing came up, and it was brought up that Menards can raise the cost of their goods if they want to increase wages, but we can't do that because we're in the service of people, and so we need to figure out a way to do it.
Thank you. Who's talking here?
We're actually expecting some kind of nasty weather in a short time, so we're thinking maybe we could get their votes and not do stories.
Okay, sorry, no more stories. We're running out of time. But tell us the first 2 things. Great.
All right, well, we thought both were important, paid and unpaid. The first thing we really agreed with is the Medicaid buy-in waiver, and we need to buy into Better Care for All. And then the second one was the sufficient reimbursements for our providers to be able to cover the actual costs.
Okay, thank you. Who's up here?
So the tornado warning has been going on for over an hour now for this county. But anyways, we were most concerned with both of the issues, and we felt that we need adequate reimbursement so that we can compete with, you know, people going to work at Menards or going to Woodman's or Aldi's up to $23 an hour. And also provide access for affordable health care.
Okay, thanks. There you go.
On the first one, our biggest story, I guess, was the priority that stress is extreme stress is by having care providers of two of our individuals. For the priority of proposals, we were, after some discussion,